At Salina Regional Health Center Rehab Department, we provide both inpatient and outpatient occupational therapy services.
Our therapists specialize in helping people to regain their function, to complete everyday tasks, from dressing and bathing themselves safely, to returning to work tasks, and even leisure activities. I'm Jolene Albright, occupational therapist.
And I'm Elizabeth Scarborough, occupational therapist.
Well, ladies, thank you so much for coming on the show. We're going to be talking about occupational therapy. First of all, what is occupational therapy?
Well, with occupational therapy, we work to restore and improve independence with activities of daily living.
So what type of illnesses or injuries or diseases of patients do you see?
Well, on the outpatient side of things, we'll see people that maybe have had orthopedic injuries from broken fingers or wrists that need to have exercise to be able to regain their hand function. Cumulative trauma like carpal tunnel that we would see to help relieve their pain. Also, people who've had stroke that need to relearn to use their arm to complete functional tasks.
And on the inpatient side, we might see a trauma such as a motor vehicle accident, neurological issue like a stroke, cardiovascular issue, generalized weakness and pneumonia, repeated falls, and then also orthopedics.
Obviously, several of the occupational therapists that work at Salina Regional, do some of them have some special expertise?
Yes, we have a couple therapists that are trained in vestibular rehab that treat the people with dizziness, as well as people that complete driving screenings to see if people are safe and can see their periphery to be safe to return to the road. And also people that work specifically with stroke people.
What type of treatments do you do?
Yeah, so it kind of just depends on the patient and what they need. But if we're talking about an activity of daily living, there's a sequential task breakdown that has to occur. That can include a cognitive component, a physical component of being able to move the proper arm muscles that you need to, and just understanding what has to happen in order for the toothpaste to make it to the toothbrush, which sounds easy, but it's actually not. There's a lot involved with it, and if you've had a stroke or you've been in a motor vehicle accident, you might need our help to restore your ability to independently complete those tasks on your own. And so we do all of that behind the scenes work to make everything work as one whole piece again so that you can take care of yourself.
Thank you so much for some great information and for coming on the show. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on X and Instagram.